Today we're going to discuss proliferative diabetic retinopathy. This is the right eye, the retina of a patient who came with absolutely normal vision. And he came only because he's been diabetic for the last 13 years. His sugar has been around 200 postprandial, and he feels everything is all right for him. He actually does not need this checkup. But if you see, this is what has happened to his retina. Now, the reason why the vision is absolutely normal is because the center of the retina or the macula is absolutely normal, except for a few hard exudates in this area, which is some cholesterol deposit. What you can actually see here in the outer part of this is some new vessels branching. In this picture, which is a little more temporal, you can see these new vessels extending over a very, very large area here. So he has something called NVE, or neovascularization elsewhere. This means that he has already developed proliferative diabetic retinopathy, even though his vision is absolutely normal. Let us take a look at his other eye. Now, if you can see again here, the central retina is absolutely normal. The macula is normal, so his vision is 20/20. And he does not know that he is progressing to blindness. If you take a look at the temporal portion of this, it's very clear here, like a tree, there is a branching of blood vessels all over the temporal part. And this area, or the temporal most part of the retina, is completely avascular. There is no blood flowing at all to the outer retina. And as a result of this, these kind of bleeders have come all over. And in one area, in fact, membranes have already started developing. So if you leave it untreated, there is no doubt that it will progress to blindness. Now, it has reached this stage only because he has not gone for checkup every year ever since he was diagnosed to have diabetes. Now, most likely he has had diabetes even longer than he thought he has. So, it is extremely important to get diagnosed and treated on time. Now, what would I do for this patient who has proliferative diabetic retinopathy? His vision is absolutely normal. Even to convince him that he needs treatment is so difficult because he feels everything is going fine for him. Nobody wants to hear the word surgery. Nobody wants to hear the word laser or injections. But if this is done on time, you can actually prevent blindness. If this is left untreated, if you don't do injections and laser for this patient, he will end up with a frank retinal detachment, which could even be inoperable because it actually looks very, very bad. So it's extremely important to take treatment on time.